Defining health disparities. Inequalities in healthcare and health disparities are well-established and costly problems for the United States as well as globally. Health professionals from diverse specialties and backgrounds face challenges in conducting relevant research and translating promising findings into meaningful practice to address health equity. Some of you may be familiar with different concepts used to discuss health disparities. One of the biggest challenges is agreeing on the meaning of health disparities and health equity because different terms are used to represent the idea that everyone has a fair and just opportunity to be healthy. This video defines several terms you will encounter in course readings to highlight the need for consistency when using specific terms to describe social determinants of health. Although there is no one definition of health disparities or health equity on which everyone agrees, there are critical conceptual components necessary to provide a framework for effective action. Ask yourself, when does a difference become a disparity? Take a moment to think about differences in health between groups you are familiar with that may not be a disparity. What immediately came to mind? Was the differences between men and women in breast cancer? Or what about sex differences in prostate cancer? Or differences between ethnic groups for sickle cell anemia? Do these differences reflect health disparities? Why or why not? Health professionals and policymakers have been aware of racial and ethnic differences in health for centuries. It has only been recently that the federal government identified the elimination of health disparities as a national goal due to several challenges. These include determining the meaning of disparities between two groups, identifying accurately the size of a disparity, assessing how racial and ethnic group membership correlates with socioeconomic position or living conditions, and understanding the role of race, ethnicity, gender, and class in influencing health from an intersectionality perspective. Health disparities are defined as differences in health affecting marginalized groups. This is not the complete story. We must also consider health equity, which takes into account the motivation for change based on social justice, including ethical and human rights. A number of terms are used to reflect equity in health, including health inequalities, social inequalities in health, health inequities, and equity in health. All of these terms suggest an underlying social injustice in opportunities and resources necessary to be healthy. Metrics for measuring change reflect social determinants of health to achieve health equity. The metrics we use to assess change include the health disparity of interest and its key social determinants. Our goal should not be to assess average change in the population's health. Rather, our goal is to document change in health outcomes for disadvantaged groups and the size of gaps between disadvantaged and advantaged groups to reflect movement towards health equity. For example, the left side of the slide illustrates how we might intervene to give the same resource to assist with accessing fruit on a tree to people of different heights. Giving each person access to a box of the same height is an example of giving everyone the same or equal resources. However, this does not translate into equity when there are differential needs across people of varying heights. The example on the right shows that we must provide boxes of different heights to achieve equity when differences exist. Health equity, then, is the absence of systematic disparities in health between more and less advantaged social groups. Use course readings to help you determine specific definitions you will use as you consider a research question or practice goal for your final paper. What contributes to health outcomes not being equitable? Remember, to reduce inequalities in health, every action must include added efforts to reach and assist the most vulnerable or marginalized groups. Otherwise, we will not close the health disparities gap.